there, very pleasant good morning. Welcome to another informative and educative edition of the program Bold Way to Health. An hour-long program brought to you by the Ministry of Health. Of course, designed to educate, inform, and empower you about health-related matters. Well, today is Tuesday, November 18, 2025, and drafting you through this edition of the program are Angela Noah and
Melvin Stewart.
And of course, we have Charles Ide here, making sure that you get access to this program through the Ministry's official Facebook page. However way you are joining us this morning, by your radio or through the Ministry's official Facebook page, we'd like to encourage you to like and share the live this morning. Invite a friend to watch along with you. Well, this morning we have invited in studio Madam Getchu Wamako, newborn coordinator at the Ministry of Health, and Dr. Clarence S.K. Wise, pediatric oncologist from JFK, who are set to provide education on preterm baby this morning. So stay with us as we take a very short break to be back. Welcome back and thanks for rejoining us. So we're not joining our guests in studio, but firstly, good morning, Melvin.
Good morning, Asia, and good morning, everyone.
It's always good to be here with you as we continue to do what we are to do for the Liberian people. So, welcome our guest this morning, Melvin.
Yes, our guest, Madam Getchu. The last name always gave me hard time. Mako, N-A-Q, okay. All right. Good morning. How you doing? That's good. Dr. Wee said good morning.
Good morning.
Hope you're doing well too. All right.
Yeah. So this morning we are set that we say in Mrs. Mako to educate the public about preterm babies. Why they are even born preterms and all that. So to set the stage for our discussion, firstly, let us talk about preterm. The term preterm itself, what does it mean when we say preterm before we come to when babies are born like that?
Okay. Good morning again, Angie, and good morning, good afternoon, and good evening to people in the rest of the world, wherever they are this morning. It's great to be back. I think I'm becoming more constant in this studio than anywhere else. But that is the benefit. That is the benefit that people should reap. That we continuously provide them the awareness, the necessary awareness, so as to provide good and better help for them. I also want to bring a greeting from the Pediatric Association of Liberia that also celebrated in collaboration with the Ministry of Health yesterday, or Prematurity Day.
Okay.
Celebrated at the John F. Kennedy Medical Center, where we showcased some of those preterm babies. When it talked about preterm, the word defined itself. Pre, if we're looking in English dictionary, the word pre is a prefix, it means before, and term. So if a child born before term, that child is a preterm. What do we refer to as term? So usually, if a mother conceives, she needs to carry the baby at least 37 completed weeks before we say that the baby has reached term. So any child that is born before 37 completed weeks, that child is a preterm. So if the child is born 37 weeks, 5 days, 36 weeks, 5 days, 36 weeks, 6 days, that child is a preterm. So preterm are babies that are born before, or in common sense we say they are born too soon, then they should come home. That's preterm.
Mrs. Mako. Good morning. Let's hear your voice first. Let's hear you first and greet our listeners.
Okay. Good morning and good morning to everyone out there. We are grateful to be back again, as God said. We always here and we here because of our newborn babies, our babies up there, our children up there. We will always be here to give information to our mothers. So I'm Getchu Wamako, newborn coordinator, and here this morning discussing our preterm babies. Yesterday was World Preterm Day, and we say the awareness, we keep giving awareness up to the child day, 20.
Okay, so Dr. Wise has already set the scene for the discussion around preterm babies, telling us what it means when we say preterm babies are born before the actual time. But let's talk about why that even occurred. Why? What are some of the contributing factors to that? So, Dr. Wise, you want to comment
Yes.
on that?
Okay. So when it comes to preterm babies, the contributing factors can be divided into two. You have the maternal causes and you have the fetal causes. When you talk about the maternal causes, it's the mother who is responsible for who carry the pregnancy, and then there are some issues that are associated with the baby that make them come out too soon. So let's start with the maternal issue.
Okay.
If the mother has hypertension in pregnancy, if she has increased blood pressure in pregnancy, it can cause the baby to come out before the time. If the mother also has diabetes, sugar sickness, it can also cause the baby to come out before the time. Also, if there are issues with the pregnancy, that the mother have bleeding during pregnancy, and the big terminology is placenta abruptio, where the placenta is where the mother is bleeding, or even socio-economic factor, mother who smoke, people who take in alcohol, especially cocaine use. Those are all causes, they are all maternal causes of preterm delivery that cause the mother to enter the preterm delivery. Even trauma, even intense exercise, strenuous or increased activity of work. That's the reason why you go to you go for antenatal care. Your doctor advises you that the kind of work that you need to do because you are carrying pregnancy. Then even because you are carrying a baby, even the cervix that's responsible to hold the baby, if it becomes insufficient or it becomes too weak, they will say you have a weak. Normally, in our layman term, we say you have a weak back. The mother have a weak back that can cause the baby to be autistic also. Then the fetal itself, even maternal infection. The mother have a long-term infection, it can cause the baby to come out too soon at the time it's supposed to come out. Then even the babies are having abnormality. They are developing, they are growing in the mother womb, and they get some abnormality. Whether it could be because of the chromosome or whatever reason, and they have abnormality, they can come out too soon. Even infection, babies that have infection, they have those intrauterine infections, like syphilis, like toxoplasmosis, they're all syphilis infection that they have. They can also make them to come out too early. So those are some of the causes when it comes to mother in the fetal and the baby too soon.
Okay, so what I'm understanding is that there are some women who experience this, prematurely birth based on health and lifestyles, and then there are some whose body normally just do that. So for those whose bodies, normally just do that, is there a way that you will prevent it?
So like that said, in that case, in our layman understanding, we say pregnant woman went to the hospital, they say, oh, the woman get a good back. What we can do, usually the doctor will advise you to have a bed rest. Either you stay to the hospital because when you say like go home and have a bed rest, when they are home, they will not rest. So what we do, we advise them to stay in the hospital for some time. So in that case, the customer or the family will be informed, oh, we want this baby to stay here and have a bed rest. Get some antibiotic, have a bed rest. If there's bleeding, manage it. If there is infection, manage the infection. Just rest.
Okay, so also when it comes to the issue that's other than the cervical insufficiency or weak back, even hypertension, that's the reason why we advise our mothers to go for antenatal care. That is the importance of antenatal care. So if you go to the facility, your doctor or your midwife or whoever that is following you up, check your blood pressure and know that your blood pressure is high. We try, there are means of controlling the blood pressure. Even diabetes, sugar sickness. If you have sugar sickness in pregnancy, some people already have that sugar sickness before they become pregnant, and other people do not have when they become pregnant and they have sugar sickness. That is called gestational diabetes. So you go to the facility, you go for antenatal care, your midwife, the doctor who follow you will have to control those things. So that's the reason, that's one of the importance of antenatal care. So some of these conditions that you have can be managed properly so as to carry your baby to term.
Okay, but we said the situation of premature birth in the country, how big it is? common it is now setting?
When it comes to prematurity, it's a grave issue. It's a serious issue in our country. It's one of the, if it's not the second or the third, it's either the second or the third leading cause of neonatal mortality in our country, prematurity. So, at our situation, it accounts for like 35% of our newborn death. So you see how staggering it is when it comes to that. So it's a serious issue. That's what I'm saying. If not the second, the third, because you have breast asphyxia, prematurity, sepsis, or prematurity is a serious issue when it comes to neonatal death in our country.
Yes, as I said, it's the second leading cause of neonatal death. And we know in our setting, preterm, being born, preterm or before time is not something that you can leave. But we just need to inform our mothers, our family, that the care and where you will be born. When you are born at the hospital, the clinic, the health center, the midwife or nurses that there, doctors that there, know what to do and will advise you, teach you what to do, and don't begin to live. But it's a serious issue. It's 35% of our neonatal death is caused by preterm. There's no joke about it. So it's a serious issue. So we want our listeners to be informed about preterm birth.
Okay, so talking about neonatal death, is it that those babies are dying because they are born preterm, or because there should be a particular way that they should be cared for, and if that care is not being met?
So yes, they are dying because born preterm, as we said, like you see for the theme of this year, where preterm, you see, give a strong start for a hopeful or brighter future from the beginning. When this baby is born preterm, the major organs still developing. So their system is not strong, they are prone to infection, they have feeding problem to feed. They will not breastfeed from their mother, they will not feed from their mother's breast, and they get cold quicker. So you have to teach the mother. And while in the hospital, if this mother is not ready or not prepared or not stable to do the skin to skin with the baby, we keep them in incubator. We got one more there. You either put them under a warmer or you keep them in the incubator to keep them warm. But when like this mother give birth or to one and TTN, the baby is home. People believe that when baby is born, the baby should be inside. The baby will be inside, but that baby inside, you're not monitoring that baby temperature. You don't know what temperature the baby get. How the baby should be around. The environment where you keeping the baby. Infection will come in, that baby will not breastfeed from the mother's breast, then the baby will be hungry. But in the hospital, we will teach you and we will help you how to feed your baby, and we will help the baby. We will teach you how to put your baby skin to skin with you, and we will keep the baby warm. And infection there, we keep the infection.
So just to add up, I would say it's a combination of both, as Mrs. McCall said. It's a combination of both. The babies are born too soon, and then the provision of the necessary thing for them, as she said. So I usually give a typical example when it comes to prematurity or preterm babies. Take for instance, you live with your parents. Your father and mother tell you that your parents tell you that after you have graduated from high school and you have graduated from college, I will give you an apartment, I'll provide a car for you, and I'll have a bank account. I'm keeping all those things for you after you have graduated from college. And at 11th grade, you decide to leave your parents' house. How are you going to survive? All those things they say they will give it to you when you graduate from college. You have not graduated from college, so you have left the house before the time you should have left. That's what happened with preterm baby. Because they leave too early, because they come out too early, some of the necessary things that they should have acquired from their mother are not there. Like for instance, the nutrients, the macronutrients, even the antibodies that the mother gave to the child, they usually give it at the third trimester, around the time the last 3 months. So if the child comes up too early, he or she will not get those things. So all those things are all risk factor, all those things are all contributing factors that will hamper the child's survivability. Then when the child comes out. Now, if a preterm born, now the Ministry of Health is doing extremely well, especially when it comes to the family health division. They are trying as much as possible now to have neonatal units in all of the counties, and they are trying now to explode to behavioral health facility and having to be one of the trainers for those neonatal clinicians and those nurses that are manning newborn babies. So those are some of the things. Imagine a woman give birth in a facility that there's no neonatal clinician, there's no NICU, and the baby is 28 weeks or 29 weeks. What's the chance of that child surviving? That child doesn't have a chance to survive because the first thing is skill and the expertise is not available. Then the environment is not available. So that's the reason why the Family Health Division of the Ministry of Health is also tackling that, going towards the county, improving the neonatal unit, improving the skills and the expertise of those clinicians to help. So it's a combination of both the baby coming out too soon and the provision of care as well.
So when you were talking actually, so you mentioned that because the babies come out too early, they don't have access to the necessary nutrients that they need in order to survive. So tell us some of the complications, the health complications that preterm babies face.
Okay. So usually there's something which was a factor that's responsible for our lungs to help people breathe, right? So usually it starts developing in around 32 weeks of delivery, 32 weeks, 33, 34 weeks. So as soon as a child comes, a child is born around 30 weeks of gestation. That child has not developed that. The child comes out, how's the child going to breathe? So breathing problem are one thing happens to a preterm baby, right? Then two, all of their organs are immature. They are not fully mature. Their organs are developing and they are not fully developed and they came out. Now, easily getting infection. They easily get infection as quick as possible because the immune system are not fully mature, and then they did not acquire those necessary antibodies from their mother. They're supposed to get fight antigens, fight bacterial, fight viral, all of the other microorganisms they do not have. Right? Then their skin. If you see a newborn baby, yesterday at the prematurity at the war prematurity deal that we had at JFK, one of the parents were sharing their experiences, and the mother said when the first time she saw her baby, she was scared. She was like, is this a child? She could not believe it because if you see the skin of a newborn baby, of a preterm, you get goosebumps if you have not seen it before. So they are exposed, they are unable to conserve heat. So the temperature will drop as low as possible. And cold can easily kill them. So those are some of the things that they face. So breathing problem, feeding, they are unable to coordinate between swallowing and breathing. So they will have difficulty in feeding. If they are not feeding, then they are then predisposed to several complications. So there are several things that are happening to preterm babies and because of coming up too soon.
And some of those things you listed sounds more like the short-term complications because if the baby start breathing properly, in as much as that baby will survive, that means they will start to breathe properly. What are some long-term complications that they come down with? And how long does it go for before going away? Because I saw something when I was doing research, something like some babies that are born preterm suffer from diabetes. I don't know how to do this. So what are some long-term complications?
So the good thing about preterm, this good thing about preterm is that once they are born early, once they are managed properly, they tend to survive like any other child, any other term baby. Once they are caught earlier, they are provided the necessary environment, they are provided the necessary treatment they tend to. One thing that they develop is delay. It's not actually a delay because like for us we have what we call corrected age. So as soon as a child is born around 34 weeks, the people out there will say 8 months. But we would tend to use weeks. So, but that for the layman reason they use 8 months. A child is born 8 months, and we know that they should be born 9 months. Going back, they also have 9 months. So that child has come out 1 month earlier than he or she should come out, right? So you will see that if the baby was born at 9 months, will start to sit around 4 months, 5 months, right? And a child who is born, maybe at 8 months, child will still there at 6 months. The mother would think that that child is delayed, but if you look at that child is not delayed because the corrected age of that child is 1 month. If you is 5 months, because if you want to say 1 month that the child should have spent there from the 6 months that child has spent out. So some of the things could be delayed, but those delays are not actually worrisome because of their corrected age. But if they are caught earlier, they are treated properly, they are managed appropriately, they tend to do well.
Okay.
And we have a lot of doctors who yesterday were showcasing themselves as they are preterms because they were born preterm. Some of them were born 28 weeks, some of them were born 29 weeks, and they are all doctors. They are all saving lives. So once they are managed properly, they tend to do well. Any other people.
Okay, Mrs. Marco. So you want to add to what Dr. Silva said?
Yeah, as that said, what we can say is depending and it varies in human. Maybe beside being born preaching that baby have another condition, or if it's just on the average, or I would just say, oh yeah, my baby can have cold like yesterday, so my baby had experienced that, oh, they always having cold. And let me tell you, myself was born as preaching. I know, and I agree to that when it comes to cold. I want to be cool, so you always see me that I call myself like I got something on, like either a jacket or a coat. I know that the cool for me is cool, but from the beginning, the care, that beginning care, we are strong people preaching. Are strong people. I can say to everybody. I'm telling you that I was born preaching. You will not know who I was born preaching on my hospital, but the care matters.
Even though preterm babies are babies though, so we can say they will be embarrassed to do certain things, but does it have a little bit of stigma, especially from the mother's angle?
Like from the beginning, like that, the young mother yesterday at the program, she was saying, can you imagine like teenager having her first baby, like that I was saying, that baby look fragile. They seem very thin and jelly like. You feel my hold this baby, my hand will just pass through this baby. So many things will run through their mind. They feel ashamed, they see their friend's baby look big and reach turn. So they'll even hold that baby and breastfeed. You will find it difficult with them. You will start encouraging them, you don't want to touch that baby. But at times as they grow, they start to love their own baby, you will see the joy.
Okay, so mothers are strong people, but at the end of the day, we are here today because we don't want this to happen in the first place, so we're creating awareness. So if there are other lifestyles or other things that mothers are doing that contributing to this prematurity or premature birth, we wanted to stop. But what are some ways it can be prevented?
Okay.
Some way we can stop, premature birth. Okay, from the angle where the mothers don't have control over it, like the one we call rebirth. How can we prevent it? Is there a medication to cure that? And then for those who lifestyles contributing to it, like infections, that one you can prevent it. So tell us some ways that it can be prevented.
Okay. So the first thing is that's what we said. That's what we stress the importance of antenatal care. So the only way we can develop, or the only way we can identify that this mother has an issue is when she comes to the facility. If she doesn't come to the facility, under no condition we want to identify that she has an issue. So the first thing is we encourage all mothers to have antenatal visit. Once you are pregnant, you must go to the hospital. Now, if you come to incompetent service or way back for the purpose of this discussion, way back, you go to the facility, your midwife, your doctor, you give the history like, oh, I've had pregnancy, prior pregnancy, but each time I take the pregnancy to this amount of time, maybe this month, I just lose the pregnancy because of XYZ reason. You go into your history, they can advise you. If the advice is not working, there are procedures that can be done, especially by obstetrician. They have a procedure that can be done to help incompetent service. Then, if the issue is high blood pressure, that can be managed in the facility. There are medications that can manage your blood pressure, keep your pressure normal so as to keep you for term. If the issue is diabetes, there are medications that can be used, sugar syrup, there are medications that can be used also to manage those complications. So if there's an issue, if there's a medical issue, the facility can manage those and make sure that you reach them. As long as the antenatal visit is there and you are adhering to the medical advice, you can carry a baby. So those are ways that you can prevent. Then your own lifestyle. Imagine if you're smoking, or if you're taking alcohol, if you're taking in drugs, you stop. Those ones are lifestyle modification. Modify them, you stop those things. That can also help you to carry a baby. So yes, those can be prevented. But for the chromosomal abnormalities, those are ones that beyond doctor's control, because they just have been a problem. They are medical, they are abnormalities that occur within the baby. But there are some risk factors, there are some things like neurotube defect. Like you see a baby born, no brain, or a baby born, you have something on the back, big knife on the back. Yes, those are neurotube defects, and those can be prevented simply by just taking your folic acid, and then they give you to the hospital, the fever they give you to the hospital. It can help prevent that. But imagine they give you the medicine, the medication at the hospital, and you refuse to take them. So that predisposes your baby to neurotube defect, and neurotube defect can cause prematurity as well.
Okay.
Those chromosomal abnormalities.
Okay, so the reason I asked that question is because most of the time people with the one that we call weak back in our common term, they can say that you have to stop doing certain things. And when it comes to them stopping that, like doing heavy things, carrying, during that period, is where we say there should be high level of support. And then I want to ask, what type of support should the male partners give to the people who's at that weak back?
Usually my call will come there.
This is not there.
So in that, a good yourself following up and doing a research. So you will want the family around say this whole issue about preterm birth or mother being pregnant is a project that not a mother womb. The family have to be involved. So in that case, your husband or your fiancé need to help you, even when they work in the house. The children there, everybody need to help you. You need time to rest, and you need to support you financially, morally. You need a support. You need family members support.
Okay,
You have more time to rest.
just to add up, we encourage the men. If your wife is pregnant or your woman is pregnant, she's carrying your offspring, she's carrying your gene, because it's a combination of your cell and that of course make the baby. So it is a partnership. So I'm encouraging all men out there to help their female counterparts, their spouses, or their women with some of these four calls. Especially if she goes to the facility and the doctor advises her and say, oh, when you go home, you need rest. And she needs rest. So that's the reason why even the last time we were here, we were talking about the safe breastfeeding week. I was here with Dr. Tabet Colley for the CHO for Maserado, and we were encouraging the men to follow their women for antenatal care. So maybe she will come home and say, oh, the doctor said I should not do anything. You say, you want to escape work, that's why you're saying. But if he's there and he sees how important the doctor is stressing that particular point that she needs rest, or else she will lose the pregnancy. I think it's sends signal down to him and know that okay, this is very important. So they are also an important part when it comes to helping the quality of the pregnancy.
Yes, I'm very much concerned about the whole preterm, especially for the part where the male partners need the help. Yeah, but Mrs. Marco, let's hear you on the way in which mothers should take care of their preterm babies, starting from the health workers' role to play and that of the mother's role to play in order to give that proper care that preterm babies need.
Okay, so for the health worker, we start with us first. Health workers that have a major role to play. Even before this baby is born, they have a major role. So we need to encourage our patient, our IBLE, as God said, or the research said, to visit our antenatal clinic. Visit the antenatal clinic, and when they visit our antenatal clinic, whatsoever condition we may see, whether it be infection or if we have blood pressure, as we can understand it, we should treat it and encourage them to take their treatment. We should also help them to talk to them, hear from them. what they are involved in. Like you go to a hospital, you ask somebody asking you, what you do for a living, or what you doing. You're not allowed to say they want to get into your own privacy, but they want to know who they're dealing with. In case of anything, they can know what to tell you. Maybe, oh, I can go all the time to buy goods, or I can go say this mother, this pregnant woman, and you know who is this pregnant woman. Going all the time, getting all car up and down, or going to sit down one place, saying I'm behind the market for the whole day. Based on her condition, you will know what to tell her. So we should educate them. Visit hospital, visit clinic whenever you are pregnant. Even before getting pregnant, start your visit and know what all there. Do your routine lab check your whole system, and you know what is happening. Then when they come during their labor now, after they get pregnant, they already in labor, they reach to us, or they reach to us at preterm labor. What we should do for them as health worker? We should monitor them, closely monitor them. Closely monitor them. If they keep in preterm labor, we have medication that we can give them, and that's it. It will help. They were trying to develop, the lungs are trying to develop, and baby came. So that lungs that stay developing with that medication that we can give will be safe to help the baby when the baby is born. And it should be safe when the baby stay in utero. So while in utero, we make sure as health worker we serve that mother the best and best to help to make the lung strong. And we also encourage her to stay in hospital, have a bed rest while in hospital, and we treat her if there is infection, we treat the infection, any other condition out there, we treat, waiting for that baby to be born. When this baby is born, we start our care for the baby. We start to care for that baby, making sure that we keep that baby warm, skin to skin with the mother, or we place the baby in incubator or under the warmer, or when the mother is there, strong, that she can carry her baby with different skin to skin.
The skin to skin warming, right?
Yes, for the feeding, we feed this baby. If the baby can breastfeed, the mother express, and we help the mother to feed this baby. So for the mother, what you'll be doing for us, we do the skin to skin. You give her breast milk, you express, you give her breast milk, we feed your baby, and we keep your baby surrounding clean and warm.
Okay, so from the beginning of our discussion, Dr. Visser mentioned that yesterday was the World Prematurity Day. And so tell us, what is this World Prematurity Day? How was it set aside to be celebrated? And what is the Ministry of Health doing, or what the Ministry of Health did? Yes, and I just give a little update about the World Prematurity Day activities.
So like the activities yesterday for the program at GFA is PAL in collaboration with the Ministry of Health to have the program at GFA. But for ministry, we have the activities are 20 days a week. Before we will be having activities up to the 20th, where is World Child Day. So Ministry of Health work with the county, the various county, our reproductive health, which we call them RH, our clinicians, our midwife, our nurses are working in NICU that we should do awareness across the county, do awareness, talk to our mothers, talk to our community people, teach them how to care for preterm, give them the importance of preterm, how we can manage them. They are still human beings, we can give them how they can live. So it's just all we were doing across. Giving awareness, going in the community, the various hospital, various NICU, it's all that we're doing yesterday. This week continue, we have some activities we'll be doing, happy baby brief activities, which will help newborn to live. Some babies can even be born preterm and be FACATS, so you still have to help them to breathe, resuscitate them. So we'll be doing our training and awareness.
Okay, as the director said yesterday was World Prematurity Day. The PW Association, we are having to be the secretary general of that association, is a conglomeration of pediatricians, also and all those who are involved in child care. So whether you are a pediatrician, whether you are a nurse, whether you are a public health, but once you are concerned with child health, you form a part of that association. You are invited, you are welcome. But yesterday we decided to celebrate the World Preterm Day because when those babies come from, we are the ones that are managing them. We are the pediatricians that are managing them along with our other group of health workers. Now, if we see that as and we are collaborating with the Ministry of Health, and I want to stress how important it is that even the minister, thanks to a good office, has invited us before we have sat, and she has asked us for way forward that will help to reduce mortality, especially when it comes to newborn, even under 5. She has given us her full support that she's willing to collaborate with the Pediatric Association. So some of the way we thought now that since today is Working Maturity Day, why not have a program to create awareness, not only to the mothers, but even to the community, so people know, people understand that there's something that exists that called the way that is born too soon. So when they know that this baby is born too soon, and this baby need all of the help, because those are people that need help. They are the smallest, and I refer to them as the smallest and the bravest fighters. So those are people that need our help. So we thought it was yesterday that okay, why not have a program in honor of them, raising the awareness. So in collaboration with the Ministry of Health, which we were fully represented yesterday, the director of the family health unit was there, and our staff, our office staff were all there. So we thought it was to have this program yesterday, increase the awareness and raise the awareness. Even yesterday we were in studio, and today again we are in studio for this same project. So it shows how important this fight is when it comes to neonatal mortality and unfavored mortality as well for pediatric association.
Okay, thank you very much. I think it's time now we open the phone lines to help our listeners participate. Maybe later on we can still go back to the discussion. So if you just join us, you are listening to Way to Health, and I would put my brought to you by the Ministry of Health. And we're in touch this morning with two health experts from the Ministry of Health, Madam Getchuwa Mako, newborn coordinator at the Ministry of Health, and Dr. Clarence S.K. Wisey, pediatric oncologist at JFK. We are talking preterm babies this morning, providing education, the information that we need to provide support for preterm babies, mothers who are giving birth to preterm babies, so that those babies can grow stronger and have a future just as we have as well. So to be a part of this discussion, you can call us on 0880-514-096, 0880-514-096, 077-567-7376, 077-567-7376 are the numbers to call. Call us this morning, be a part of this discussion. You can also contribute. Maybe you know a mother that struggled with this condition and you provided support, or you have beautiful ideas, recommendations, you can also call. We gave that this morning. So the numbers are 0880-514-096, 077-567-7376 are the numbers to call. So Dr. Wisey and Mrs. Mako, Madam Mako, while we are waiting for the callers, we can still go back to the discussion. What is this? The causes of preterm, the causes of this preterm, like you mentioned. What are the role communities should play? Because when I hear you say talking, we talk about going to the communities, raising awareness, and we have community leaders. Do we have roles that community leaders, elders should play when it comes to clinical teaching?
So the community have a major role to play, because you and I are in the community everywhere. So in the community, our community people, they believe in our leaders, and everyone, like, we care for one another in the community. You know well today, and when I pass and speak, where your mom? She is out, she not well. 1 or 2 times I see you are pregnant, you're not well. I should encourage you to go to the hospital. When you visit the hospital, some mothers will go to the hospital when they give birth, and they say, oh, you have to stay here because this baby, the time I wish you have to stay about the baby. They will refuse. Many days will be like, asking, they will refuse because the time. Some will start, but because they are taking long being in the hospital, and the whole issue of caring for preterm, and as Dad said, for them to grow that wall, it will come up. Sometimes when you look at that. So the more the mother stay in the hospital, she will feel discouraged. She want to go home. She missing her family. So the community can help to create that awareness, encourage all of our pregnant women, all of our babies, mothers that have preaching, and even babies with other conditions to go to hospital. As we live in the community, it will help too.
Okay, so the community members can also help by providing, remember we're talking about social and economic status, also emotional support. Now, if you in a community you see a pregnant woman who is pregnant, and you see her pounding rice, you can advise her, you're pregnant at this age of the pregnancy. Why are you pounding rice? And you know that's kind of right. So you want to help her. Oh, I can help you. That's a support you have provided. That's a help, right? Now, even community leaders, we tend to listen to our community leaders a lot. Community leaders can encourage their pregnant women. That you pass in a community, you see a woman who is pregnant, you can ask her, oh, you're not going to the hospital for a while. Why are you not going to the hospital when you're pregnant? So those are all things that we do.
Alright, so let's take our first caller. Good morning.
Good morning.
Your name and where do you join us from? Okay. Alright, thank you. 08805140096, 08805140096, 0775677376 are the numbers to call. Cut us this morning, be a part of this discussion. That we said. While we wait for the callers, let's get back to the discussion. So, let's talk a little about the challenges that you face as government, as hospital, caring for preterm babies. Because I think when you were explaining about the pediatric association, you mentioned that the pediatricians are not really many in country. But let's take this caller. Good morning.
Good morning. Yeah, good morning.
Your name and where do you join us from?
Yeah, my name is Leonard B. I'm calling from Red Light.
Okay, go ahead.
Let me thank you guys for the discussion. But there was something I wanted people to actually help me with. Because my general mentioned some problem for the past time now. But each time you get pregnant, sometimes the pregnancy will go like 1 or 2 weeks, and with that look, it will move. So the mentioned are coming for a very long time. So I don't know what I can do because we go to hospital, we go to clinic. Sometimes they will say that we back, and so I don't know what kind of advice I can give me so I can tell them.
Okay, thank you. 08805140096, 0775677376 are the numbers to call. 08805140096. Maybe we have another caller. Good morning.
Yeah, good morning.
Your name and where do you join us from?
I'm Kuzu, and I call from the community.
Go ahead, please.
Actually, this is inspired by Cody Monrovia yesterday. The issue of premature babies being born and not need to be done when it comes to the awareness raising. And one of the things I'm
Okay. Okay. All right. Thank you. So we don't have much time like that. So, like we said, can respond to the caller's concern. Then we have another call. Okay, let's take this person. Good morning.
Good morning, how are you?
I'm fine. Your name and where do you join us from?
My name is Inabdoya. I'm calling from Papa West.
Go ahead. Hello. Maybe we can continue. We'll call back. Yeah, so like we said, my call, let's respond to the caller's concern and then
Okay, so the first caller call, he talked about aggression of healthcare workers. That's one of the things that we always stress up. People come to the facility with health condition, you don't know, they have some mental, like some
mental health issues.
emotional stuff going on. So as much as possible, we should be as very calm as possible. That is non-negotiable. A woman come to the break, even a mother or a father or whoever come to the facility should receive care as much as possible. And the care is not only the medication that we give him, even the counseling, even the talk that we do to you, help to relieve you, right?
Yeah.
Then this other call that he keep losing pregnancy. I think I would advise that he sees an obstetrician. It would be better. He sees an obstetrician, a woman doctor, so as to know exactly what's the cause. If it's cervical incompetence, there are medical management for it, or procedure that can do what's called cerclage, but I would not see a diagnosis for him now, but he needs to see an obstetrician who will help in that. Then the awareness, yes, we need the awareness, especially for our rural women. I was in Benji and some of the facility we went to, it's not acceptable to car, so some of the women that we go to see care, we have to ride it back. So those are some of the issues that comes with the government. And I usually tell people, I say when it comes to health, health is holistic. It's not just the Ministry of Health. Public Works is involved, Ministry of Agriculture is involved, the Ministry of Education is involved, Gender and Children. So everybody is involved when it comes to health. Health is not just the Ministry of Health responsibility. So those are some of the things. But we'll keep making the awareness and we'll keep informing the public about how to prevent and what to do.
Yes, our answer is like everyone have to be part of it, because even like for our baby's mother, our patient, we refer some facility, you can even get internet to make a call, and this thing to cover this thing bad, but all we can say is we keep informing our people on the condition or what they should do to prevent all of these conditions for our babies.
Okay. That's what we said in Madam Accord. I mean, this is the next question I was battling not too long. I still want clarity on that. What are some challenges you face as a government or facility caring for preterm babies?
So I will let Madam Accord to start from the administrative government aspect, and I will come as the
Yeah, no, the
aspect.
reason is because, like, I don't know how many pediatricians we have.
I will give you that.
Yeah,
number.
all that.
I will give you that number.
I will answer that. So let me start at that end. So when it comes to like me and I were walking in, I was just like talking, like telling him about some any activities that we have to do. We have a challenge. We know when it comes to newborn, actually the government we're doing something, we're doing well because we're going at certain level. Now in across if you think counties, all the referral hospitals have a NICU, but we still have more to do. We have more to do. We have NICU, and some clinics, some health center don't have a NICU, don't have what it takes to care for a newborn baby or babies, so we need to do more. And like just keep pushing, especially when it comes to our minister and our family health director. We keep pushing. We're looking all around, everywhere, and we got few our partners that keep helping to provide equipment for our NICU. we got UNICEF, and even like the few months back, Chinese embassy donated some baby crates, warm-ups, and we share it across everywhere. UNICEF got some distribution to do with oxygen seminar across country again. We got, even when it comes to the training of staff, because NICU will not be everywhere, but if this staff is trained, this midwife or nurse have to clean it, that where car, you have a car to reach, or the distance is far, or they train how to care for our newborn or for babies, they will start the care there, what can be managed there before referring. So we got our training plan that the pediatrician help us, that are with her, and others that are home, that are crucial, that are home, and others help us to train our NICU staff, our pediatrician, our neonatal clinician, peace clinician, midwife, nurses, writers to care for our newborn. So from our angle, is what we do in the issue of the family health division. When it comes to newborn, when it comes to maternal, there is no rest, but we still need to do more.
That's what we said.
Okay, so
We don't have time now. So.
yeah, so just to answer your question, when we talk about pediatricians in Liberia, we have roughly about 30 pediatricians in the entire country.
Okay. All right. So we don't have time, and we are out of time already. So just give us your parting comment, and then we hear from Madam McCall, then we can call it a day.
Okay, so as on behalf of the Pediatric Association and our president, Dr. Cecilia J. Nutter, we want to say happy Working Maturity Day to all those preterm babies and those healthcare workers, those family and everybody who work with joining along with them. And thanks to the Ministry of Health for this continuous awareness and education exercise. We whether it's true that we pass whenever we have invited to participate in such endeavors. So again, thank you, Melvin, and thank you, Angie, and we hope for a fruitful day.
Okay, so many thanks to our guests for sharing such valuable insight this morning, and thanks to you, our listeners, for playing your listening role this morning. Our guests have been Madam Geshua Makor, newborn coordinator at the Ministry of Health, Dr. Clarice S.K. Wisse, pediatric oncologist at JFK, who have been here this morning talking to you about preterm babies and how to properly care for them. Well, with that, this is how we'd like to leave you on to this edition of the program, Roadway to Health. We have been your host this morning. I have been your host this morning, taking you through this discussion. Angeline Noah and Charles Aibin has been here going live. Until next Tuesday, have a good day.